afternoon. This is Dr. John Bennett, broadcasting from Miami. Today, we have the pleasure of having Yannick Beaulieau, an intensivist from Montreal, Canada. He's going to tell us about his wonderful platform for remote mentoring called REACTS. This is part of the ACNS online conference for use for neurosurgical education. And I'll let Yannick basically run the show. Hello, Yannick.
Hello, John. How are you today?
Very good. I'm glad to have you back.
Thank you. Nice. It's a pleasure to be with you today.
Okay. Do you want to just basically tell a little bit about yourself, about your platform, and you can launch into a demonstration?
Excellent. So what I'll do is start by launching my PowerPoint, and I'll introduce the platform, show a couple of videos that will be in the PowerPoint, and then I'll go and share my screen showing the application itself. Okay, so I'm going to start by sharing my PowerPoint, which is, I just have to fire it up in the background here. And here we go. And I'll put this full screen like this. Okay. So as you mentioned, I'm a cardiologist and critical care physician from Montreal. I'm practicing at the Hôpital du Sacré-Cœur de Montréal. I also practice at the Montreal Heart Institute, where we cover the intensive care units. And I'm the president and CEO of a company called Innovative Imaging Technologies. So I'm the founder of the company and started the platform called REACTS 4 years ago. And the idea behind REACTS was really to bring something that would go one step further in terms of bringing a way to very dynamically and very collaboratively have a way to connect people anywhere throughout the world beyond just the video conferencing type of platform. So, in fact, the word REACTS stands for Remote Education, Augmented Communication, Training, and Supervision. So REACTS, in fact, really needs to be seen as a digital collaborative platform. And we brought the term called hyperpresence. So we go beyond the typical telepresence experience to bring way more to the interactive process, and we'll see how this comes to life. So we call that hyperpresence. So really the platform is pretty simple, flexible, intuitive, and it's geared not just toward, talking and seeing each other, but toward pushing collaboration, supervision, education, mentorship, and remote assistance. So as I mentioned, we're based in Montreal. I have about 20 employees right now. Some of them are temporary, some of them are permanent. And we have quite a team really built around a core of experts. And our goal is really to enhance remote interaction through multimedia digital collaboration. So we designed the platform from the start as we wanted to make this clearly focused on the medical world to be compliant with the various types of certification. And the different countries have different specifications. The one in the United States called HIPAA is one of the strictest security compliance for the standards in the industry, and we're compliant with this standard and other standard from other countries. So the idea behind REACTS, before we jump into the demonstration, was really to bring together high quality video conferencing, either peer-to-peer or bringing many people to the session at the same time. We wanted to be able not only to stream one camera, like when you show your webcam and the other people see it, but we wanted to bring multiple video feeds so that a remote user can put, for example, one webcam, one laparoscopy feed, another which is the patient monitor, the other one could be the microscope used by the neurosurgeon. So the user can use multiple feeds and broadcast that to distant users so that they can see from different perspective what's happening. There is for sure application and screen sharing, as I'm doing right now with my PowerPoint. We incorporated instant messaging so that people can communicate not only live, so what we call synchronously, what is called synchronously, or asynchronously. So we may not be available live to discuss something. So by having this secure messaging where we can send files, images, videos, and share all kinds of different procedures, and it allows more flexibility. So we brought a way to have all kinds of sharing of multimedia material, images, video, 3D objects, audio files. So the idea is to be able to play with this collaboratively, superimpose stuff so that you can have, let's say, a 3D object virtual superimpose on the real one to show and guide the other user. And we'll go through that. We incorporated tools to be able to have checklists and reporting tools incorporated in the platform so that as you're doing a procedure or supervising a procedure, you can be looking at your checklist and, just checking the boxes as the person does what they're supposed to do, take video or image as it goes and incorporate them in your report or checklist so that you can have everything in one, so you don't have to go to 3 different platforms to do your endeavor.
Excuse me, Yannick, you're still on the first slide. Do you still want to be on the first slide?
No, I'm still on the first slide, you said?
Yeah, you got to click on the slides.
Yeah, that's what I'm doing.
Okay. Well, try
clicking. Stop the sharing, and I'm just going to restart it.
Yeah, okay.
You tell me if you see it better, so hang out.
The bugs are plaguing us here.
So screen share, I'm going to share the PowerPoint, share, and I'm going to go full screen. So do you see now the one called on the single platform React?
Yes.
Okay. And now as I'm clicking on it, do you see the stuff appear?
It's not changing.
So what I'm going to do is I'm just going to remain in this mode like this.
Okay. Maybe sometimes you have to physically click on the slide on the column on the left. Physically click on it when you want to change.
Perfect. So let me check.
Click on another slide. Let's see if it works here.
Yeah, here I just changed. I don't know if you see it. It's called Software Solution, Low Cost.
No, it's still on the same one.
So look, what I'm going to do is I'm just going to share my screen instead of sharing the PowerPoint.
Okay.
Let me try that here. So entire screen, share. I think this is going to be better. So let me fire my PowerPoint. Okay, I'm going to reduce that. I'm going to go here. Okay, do you see my PowerPoint now?
Yeah. Okay, yeah.
Okay, now when I'm changing...
Excellent. Big. It's nice and big, too.
Okay, perfect. So sorry about that. So let me restart where I was here.
Sure.
So for some reason, the PowerPoint didn't change, but now you'll see everything. So I was talking about the fact that, the general uses of Reacts and what you can do in one platform. So an important word here is integration, so that it integrates different functionalities. So we talked about the high quality video conferencing, streaming of multiple simultaneous feeds, application and screen sharing and instant messaging to allow synchronous and asynchronous communication, multimedia sharing in different forms, checklists and reporting tools. So we also can, as the person, if you're doing a remote assistance, you can record your session, take snapshots, you can annotate them so that when you archive them, you can go back and see what you took. Then we also incorporated innovative tools so that you can perform augmented reality and real-time image overlay, as I'll be demonstrating. So now, John, it's okay? You see the slide changing?
Yes, we can.
Okay.
I'm here too.
Okay, perfect. So here, an important point also about React is that it's a software solution, so it's based on a yearly license. So the person can use their own laptop, desktop, cameras, so off-the-shelf consumers' electronics can be used. It's a low-cost solution based on an individual license. Every user has 2 GB of cloud storage so that they can record their image, their pictures, and I'll get back to that a bit later. So when it's in multiple language, right now the platform is in French, English, Spanish, Portuguese, and Chinese. So and we'll bring a couple of more language as time goes by. So we talked about the fact it's a highly secure connection, so you have to be able to communicate. You could be at home, the person you're talking to, or you're maybe mentoring somebody who's in a hospital, in a clinic. So we really wanted to make sure that the way the security was made allowed you to go through all kinds of different firewalls and work in different scenarios. So let's talk a bit more about the features. So first, it can go from a very simple face-to-face secured video call to a multi-party session where you have, we have in our current version now up to 6 people at a time that can do a fully interactive session. And we're going to put out in fall time the webinar version where you'll be able to have up to 100 people at a time watching a session. We have incorporated a feature called the virtual pointer, so that if the user is holding their tablet or their camera, or if you have the camera, let's say, of a microscope doing a neurosurgical procedure, when you see the video feed of that microscope, you can superimpose that virtual pointer and you can interact with the other user to point at things directly in his screen on his video feed. I'm going to show a little video here, and what it will show is one of the characteristics of Reacts where you can connect multiple video feeds. So here you can see, this is a screenshot of Reacts, and on top you can see there are 2 webcams and a monitor. So the remote users is having these 3 video feeds connected, and here you can see my video feed at the bottom. So if I start the video, I don't know if you're going to see it smoothly or not, but so what you see here is that at a distance I can take the video feeds of the other users, my own video feed, I can play with them, place them where I want. I can make them bigger, smaller. I can crop them. So here you see I take the patient monitor video feed, I put in the screen, I move the webcams around. So you can really do anything you want on the live video feed. So here I'm just asking the person, okay, put your hand, and I'm going to just do a simple right click on his video feed so that I can go and crop. It's kind of a zoom and crop type of feature, so I can go exactly where I want. I arrange exactly the size of the area I would like to zoom on, and then when I'm ready I just click on apply, and then I can take my pointer and say, okay, do this there, do that. So it's really a fully interactive communication. Here I'm going to show another example. This is during a cardiac surgical procedure. So how it goes is that in the OR, there are 2 cameras that shows, I would say, the general operating room from different angles, and the surgeon, the cardiac surgeon, has the camera on his head, so we can see the video feed of the head camera, and we can see 2 other video feeds. So I can play with them, move them around in the screen, and be in live collaboration with the surgeon at the same time, and whatever is happening in the OR, you can see it live from these different perspectives. So you can imagine any type of video feed connected, allowing you to do that. You can then, as we talked about, just do the simple screen sharing. So the person may be popping up a CT scan, an X-ray, an MRI, and you're looking at it live, just through the secure share application, share desktop type of application. Here I'll show you how you can use virtual guidance with 3D objects. So here what you see on the left is a real ultrasound feed from what we call an ultrasound phantom. So these little blocks where you can scan them and practice putting needles and practicing. It's in fact simulating as if you were looking at a blood vessel with ultrasound. So there's a webcam pointed at the hand of the user so that we can see what's happening with the hand. There's a video feed taken directly from the ultrasound device, and there's a webcam that just shows us the person. And in Reacts, I can go into the 3D objects section, and I can upload. We have put a couple of 3D objects in there, and anybody that has a bit of graphic artist experience can import their own 3D objects in Reacts, and I'll show you here how it's used. So at a distance, I can take my virtual probe. So here you can see a virtual ultrasound probe that appears, and I can put that virtual probe, I'm just playing with it with my mouse, I'm superimposing this on the probe, on the real probe of the other user. I make it semi-transparent, and then remotely, just by moving that virtual probe, I can tell the person what to do. So here I can take the probe and tell them, okay, come closer to me with the probe, and as I move the probe, the other user just follows what I'm doing by looking at his screen, because on his screen, the user sees the same thing. He sees his probe, the digital probe, and he just has to follow it. So you can do that virtual assistance by using virtual 3D objects, And I'll show you later how you can do the same by using real objects. So here I'm using the virtual pointer just to tell him, you know, put your needle exactly there, and I can see at the same time live what's happening, and I can see the needle going in. So I'm telling him, okay, stop, now you're in. So you can do this remote live guidance either by just using simple things like the virtual pointer, more fancy things like the 3D objects that you can really have them follow you. So again, you can see how this is completely different than what you would do during a standard video conference endeavor. Now, you can also, as you're doing the procedure, you may be interacting with someone who doesn't have a great internet connection. So the person may be taking snapshots, either video or stills. They can put annotation and send them to you. So if your internet connection is not good enough to do live, but when you receive the image or video, you can look at the annotation, you can interact over it and give your guidance, put another annotation, and then send back to the person. So instead of doing live, you're doing what we could call near-time interaction. And I'll show you in a few minutes how you would be able to do that. So the idea here is that you can still have a fairly very precise collaboration, even if you're in a low bandwidth condition that may preclude you from doing a live video conferencing. So we wanted to make sure we had a solution to bring this asynchronous way of communicating to the clinician. So also, I was explaining that you can, in advance, here I made this checklist about thrombolysis and stroke. So the person may be at a distance looking at someone in an emergency room. He could be remotely connected to the emergency physician, examine the patient with the ER doc, and then as the examination takes place, they just fill up their checklist for to see if they're candidate for thrombolysis. They can see the scan at the same time and incorporate images from the scan in their checklist so that when they're done, their report is finished and they can have their NINDS scores right away and tell the clinician if they can go ahead with thrombolysis or not. So the idea is really to, again, integrate all these things together. You can also use the application for medical simulation. So you don't have to be in a live session. You could be, as I'll show you here, I'm going to have the video start. There's some audio. I don't know if you're going to hear it, but it's not pertinent anyway. So here the fellow is in the ICU. We have placed 2 webcams that you don't even see on the video. We have placed a feed that gets us the monitor of the simulator. So here you can see the screen of the computer in which the feeds are connected to reacts. And right beside is the operator of the mannequin to have the pupils change and the blood pressure and everything. So here we can see the exact screen of reacts where we can see the fellow as he's taking decisions. And here I'm going to skip a little bit in the video. And what you're going to see are the people that are remote. And they're just in another room on a standard computer, and they can see everything the other person is doing, and they can do the assessment live. So here they're kind of using it internally just to do this assessment simulation. So the patient, the student could be at the other end of the world or could be very, very close by in the next room. So it could be used for this educational assistance. Here I'm going to show you a video that we recently did. I'm not sure how well you see it when it's streaming, but we have performed a remote ultrasound session between people that were in Calgary, Alberta, which is quite a long way from Montreal. And I was in Montreal. I took some time during my rounds, and here you see the result. So I was just covered by my colleagues as I was assisting them. So the user here are performing the bedside ultrasound. I can see their ultrasound feed. I can see their hand. And here you see I'm superimposing an image over the live feed that the trainee is showing me. And I can play with the opacity of that video feed, so that of the image, I mean, over the video feed, so they really understand what's the anatomy. Here what you're seeing is I just dragged and dropped a normal ultrasound feed at the bottom of the screen, and they can see the normal ultrasound and the live ultrasound that they're performing so that they know what to aim for. Okay, so during the session, I can put images, videos, objects that we can just share. And here I'm telling him, open up the mitral valve so you can see it better. So you can see how I can remotely interact live exactly on what the user is doing. So here I'm going to skip a little bit in the video. So here you see I'm showing them pathological clips. So in the upper part here, we can see the live feed of the user. And at the lower end, we can see a pathological case. So when you're doing a live procedure, you can be showing cases as the user does the live procedure. Okay. So I'll show you a little bit further. So this is the setup on my end. So here you see what I'm going to be doing. What I'm doing as I'm going to stop the video, I'm taking here, it's a 3D printed probe. So I have a file of an ultrasound probe. It's just a digital file. I printed it in 3D with a 3D printer. And what I'm doing now is you're going to see that I'm going to superimpose my video feed. There's a webcam here focused on this dark background. And by just decreasing the opacity of the video feed, I'll be able to place my hand over the participant's hand so that I can really have this very interactive way of showing him where to position the probe. So here you'll see, you see that I'm putting the video feed right over his video feed. So I can show him how to do the imaging of the inferior vena cava as he's doing here. So even if we're, hundreds of kilometers from one another, I can have my own hand over his hand to show him how to position the ultrasound probe on the abdomen of the patient. So you can see here the assistance being performed. So again, this is a way to have something that's really practical like ultrasound that you need to have your hand on the thing to do, but remotely I leave the user to have his hands on his ultrasound machine, but I can assist the user in a very practical way and bringing my own feeds, my own hands in his own ultrasound feed so that we can interact together. Here I'm showing you a picture of some of my colleagues that are doing a remote assessment for ultrasound supervision with people in Haiti. So you can see the two people from Haiti here, the person from Montreal, and the video feed from the ultrasound. So they can really make sure that they teach them, they supervise them, and they help them get the correct diagnosis. They can train them just by having this remote mentorship through the platform. We recently had a session where I'm going to start the video here. I was in Montreal, and I was giving a session to ER physician from Beijing in China. So I was showing them how to use ultrasound for guidance of central venous access. So here we can see just a few pictures. So the nice thing with React is that you can use the platform to directly present in it. So instead of being a PowerPoint, you're directly showing video feeds and slides in the application. And what it allows you to do, I'm going to skip a little bit here. So it allows you to do so as you can see here, I don't know how well it comes out, but I'm using an ultrasound probe, a virtual probe that I can move in the object, in the picture, and by moving the 3D probe and the needle, I can really show them how they should be doing the procedure. So the idea here is to be able to communicate from anywhere to anywhere in the world. I'm going to show you here a video of React that was used to broadcast a live surgery, a cardiac surgery. So about 15 cardiac surgeons from different places in the world came to attend a 2-day course on what we call the RUS procedure. And here you're going to see the surgeon is live in the OR, and there's another surgeon in the conference room that does the full interaction during the procedure. So here the anesthesiologist first shows the ultrasound image. It was a significant aortic stenosis. So he's doing this live discussion. And then now we're in the OR. So there's a camera at the head of the surgeon. And there's another camera showing overall the surgical field. So here you're going to see the setup is super simple. The webcam that is on the head of the surgeon, and the other webcam that is at the head of the surgical field are just connected in the computer. And then there's a live broadcast, which is made of these different video feeds in the conference room, so that the attendee can see live exactly what's happening. They can ask questions to the surgeon. So this allows this really straightforward telesurgery type of communication or mentorship. And they were there for 3.5 hours looking at the live surgery every step of the way. I'm going to show again, remaining in telesurgery, here a laparoscopic procedure. So it's a hemicolectomy being performed. So the video feed from the laparoscopic machine is just taken, brought to Reax in a computer, and then the person is live at a distance, can see the live video feed and interact on it, either with pointer or with his own hand, just being able to see exactly what's happening and doing some either supervision, training, or mentorship. A project was done at Centre Hospitalier Universitaire de Montréal, which is one of the biggest hospital centers in Montreal. It was used by neurosurgeons. They performed 20 procedures, both cranial procedures and procedures for the spine, and they used it for training their fellow. So here you can see, this is the chief of neurosurgery, and you can see the multiple video feed. I'm going to go to the next slide. So there's a camera which is focused on the surgical field. Another camera is showing the global area where the person is doing the surgery, and another video feed is coming from the fluoroscopy machine. So the neurosurgeon can be in his office supervising the senior fellow doing the procedure, giving training, giving live assistance. So we can see different feeds here. Other fellows can be in the room with the surgeon, and they can see exactly what's happening. And not only the surgeon doing the procedure is getting all the training and mentorship, but the people at the distance can get the education from the intervention. So they also connected the video feed from the microscope directly to Reax, so that the surgeon at a distance can interact on that video feed and guide the person. So they did these 20 interventions. They produced a 47 pages report on the use of Reax. Unfortunately, the report is in French, but it's available online, and they were super good evaluation and results from the project, of giving more autonomy to the fellow, of helping to do very comprehensive training, which is even better than when the surgeon is sitting or standing by the fellow. So the remote mentorship, even within the same hospital, provided very, very good results on both the practical and didactic aspects of the training. So as you can see, there are multiple applications in healthcare of the platform. It could be used for clinical settings, for remote consultation. It could be home care, readaptation, wound care, tele-ICU, tele-stroke. But it could also be used for remote education and supervision, for remote assistance for procedure and surgeries, and as a tool for the briefing and debriefing aspect of simulation. So what I would like to do is to show you the application itself. So John, can you tell me if you see the Reax screen right now? You should see blue.
Sessions, contacts, settings.
Fantastic. So now I showed you I would say the didactic part. Now let's go into the real thing. So what I have now is my Reax application opened up. Okay, and I'll show you first one of the very important thing in Reax is that you have a library. So if I click on library here, you can see my library opening up, and it's divided in categories. So on the left, you can see images, videos, 3D objects, snapshots, documents, checklists, and reports. So you could be, let's say I'm on an airplane, I'm not even online, and I fire up Reax. I can connect even if I'm offline, and then I can go and populate my library. So I may say, you know what, I'm going to be assisting a specific neurosurgeon to do a procedure where I need to show them schemes, pictures, images. So I can click on import new image, go on my computer, go in my folders or USB key, organize all my images by folder. So if I go here under ultrasound, I have a bunch of different images. So you just organize the information the way you want. If I want to add some videos, I'm going to go into the video section, import new video, get my training videos, organize them. You can then put 3D objects. You can put checklists, documents. So you're going to go get a bunch of PDFs or Word document that you want to share during the presentation. So once you're done with that, anytime you're in a session, you can go to your library, go pick something you put in there, and show it during the session. Remember that everything that you leave in your library is in a secured, HIPAA-compliant environment where you can transfer files, and even if you have patient data in there, it's all protected. So you also have, here's the checklist and report creator. So you can click on checklist and reports. Let's say I want to do a checklist template, create template, and then I just start here. I may say, okay, I'm going to start by adding here. So neurosurgery procedure, and then I'm like, okay, next thing I'm going to put the name of the patient. So let's type name, whoops, and then I'm going to go to the next one. Let's set the date. So you can see how you're just creating your checklist as it goes. So you could say, my next thing I'm going to say is, was prepping adequate? And then I'm going to go to the different types of answers. So radio button, one answer is yes, one answer is no. If I want, I can give points to this answer. So let's say if the prepping is adequate, it's 3 points, and if it's not adequate, it's 0. So then you can see how you just create your checklist. And then you can be going in a mode where you just practice it. So I go to the fill mode. And this is where live during a session, you would just be, typing the stuff. Okay, Joe Blow, here June 25th. And then, yes, the person did well, yes or no. So very simple, very intuitive to create your checklist or report template. So, so now let's go into a session. So if I'm going into a React session, when I'm in a session, you will see on the left side of the screen, you can find again the exact same thing that is in your library. Images, video, 3D objects, so that it's simple. It's intuitive, you know where to find the information. And on the right side, you're going to see the different type of actions. So you can connect, you can start a session, you can transfer files. So one of the unique thing in React is that you can build your entire session in the application and then just fire it up and call someone. So for example, if I go to session and I'm going to go open session. So I have a bunch of different sessions here. If I go open the one I did for ultrasound guided catheter placement, let's go open that. So what it's going to do is that it's going to go get all the images, videos, and scene that I've prepared. So if I go to images, I'm going to see a bunch of images here that are images that I have put there before. If I go to videos, all the videos that I've prepared are all there. So then during a live session, I created, all kinds of scenes. The scenes are all there on the left. So I can go here on another scene, let's say like this. The minute I click on it, the scene appears, and this is all interactive. So I can pick up the 3D probe that I have placed there. I'm moving it around, as you can see. So here I can then take the needle and show, okay, I'd like you to place it there, place the probe there, move it like this. So in React, you can incorporate your images, your videos, your 3D objects, and when you're ready, you would just go to connect and then find your contact, fire up, start the meeting, and be interactive and do all of that live. Okay, so I'm just going to close that now. Sorry, I'm just going to close this meeting like this. Okay, so now I'm just going to go back to the live session, to the beginning. So let's say we want to do some interaction. Let me show you. At the bottom, you see my webcam. I'm placing my webcam here. Let's say I would like to add a second video feed. So I'm just going to take, this is a webcam. It's like a microscope pen webcam. So I'm just going to connect it in my USB port. It's really plug and play. So as I do that, my video feed appears, and I can right away take it, put it in the picture. And then here, I'm just going to do the focus. So I have my second video feed here looking at my eye, so that you can see on the left, you can see me, you can see what I'm doing with my overall webcam, which is on my computer, and you can see my other video feed. So this, I could, let's say I'm doing a recording of that. So let's say I'm going to click record. So now I'm doing a recording. I can take my pointer and talk about this point here, this, and then I could crop it. So let me do right click on that image, crop, going to focus this there, apply, and then I'm going to stop the recording. So you can see how it's, drag and drop. Let me just remove that video feed. And the recording I just took, if I would like to review it right away with the user that is remote, I'm just going to open my snapshot gallery. The video I just took is here. I'm going to put it right there. Okay? And now you can see what I just recorded. So imagine that I would be a remote person and I just received the video you just did. You could annotate that video. So I could do a right click on that video, go to add a note, and then I could say, I'm going to type anything here, but here is the lesion I told you about. How should I address it? So then that comment will always remain with that video. So if I go here where there's a little page icon, when I put my mouse over it, I'm going to see the text that is associated with that video. So now if I'm a remote person, I could be interacting over that video. So I receive it in Reacts, I take it from my snapshot, I put it on my scene, and let me show you here some fancy things. One thing I can do, which is pretty cool, just before showing this to you, I'm going to show you the setup. So here I have this piece of black cardboard, very simple, and I have this camera holder. So I'm going to place my camera right here, okay? So that by doing this, I'm placing my camera and I'm going to focus it on this black piece of cardboard like this, okay? Okay. Now what I'm going to do is I'm going to take my previous video, I'm going to place it back in the screen, and by placing this webcam here, from which I'm going to change the opacity, I'm going to bring the opacity down to 58%, that's great. So now what can I do? I can put my finger, whatever I want, over the video feed of the other person and directly interact on it. So now I can say, okay, I'm taking my scalpel handle here, and I could say, here is where you have to do the cut, for example. So I can take my own hand and just interact live on the video feed of the other. So this can be done either in a live way. So if the person is doing the surgery, I can take my own tools, my own hand, interact over their feed and tell them, do this, cut it like that. So very, very interactive. Or it could be asynchronous. So I could be watching the video of the other user. Now I'm going to be recording over it. So I can now, over the recording, explain this here is how you should do it. You should, point like that. And then I could say, I'm going to take my pointer, put a different color. And with the pointer, just go over the video. So now what I just did was just to record a video over the video of the other person. So here, let me show you. I'm just going to take that new video, put it here. And what you see now is the video I just recorded. So I could forward that back to my student. So even if we don't have enough internet to do a live procedure because of bandwidth issue, he can send me the video, I interact over it, I send it back. So it's what we would call near-time communication, which allows you, if you have good bandwidth, that's great, because then you can do all this live interaction. So it shows you again how the important points about Reacts that are different from other platforms are to really bring all this degree of live interaction. Let me show you something else here. I'm going to go into my images and I'm going to go get a CT scan. So here, if I go to demo images, I'm just going to open my folder. Remember, I told you, you just upload your images. So I can go get a picture of a CT scan here. If I would like other things, I have a chest x-ray, another x-ray. And I'm going to go into my 3D objects, and I'm going to go get a 3D objects of a brain. So we just uploaded an object with an extension called OBG. So I'm going to take, the brain is here. I'm going to put it here. Let me take another one. I'm going to take a virtual scalpel and a virtual needle. Okay, so now we could have fun. I could take that 3D brain, put it here, and I can manipulate that brain the way I want. So now I can superimpose it on me, and I'm going to right-click on that brain, and I'm going to play with the opacity. Okay, here you go. So here, imagine I would like to explain to a user. I'm going to put a CT scan here right beside me, and you will all see this left frontal hemorrhage here on the CT scan. So imagine I have students or people that are not that great with neurosurgery, and I want to explain them how come this is on the left side, and how is it represented. So I asked them to look at the left side of my screen so they can see the brain superimposed on my face, so they understand what's left and right. Then I tell them, here, this is the left frontal lobe. So then I can take that brain, I can move it around so they really understand well, okay, like this, and I can bring it now on the CT scan. And if I flip it around like that, and I just superimpose it on the scan, they can now understand what correlates with this area here, okay? So they can see the bleed, they can see the brain, and then I can take that brain back and move it around again, superimpose it on me, so they really understand that specific area. So now, if I would be live, I could take, these other, I will take, for example, a scalpel and a needle, okay? And here again, imagine any tool that you would want to use, and I can tell the user, okay, put the needle exactly there, and with your virtual scalpel, you can interact over their feed and tell them where they need to cut, for example. So here, as you can see, I can put, I'm going to remove the CT scan, and I can put the virtual objects directly over my own video feed. So I could say, cut here, and then put the needle here, move it like this. So, and if I want to document all of that, now I'm going into my checklist. So I'm going to take here just an example. It has nothing to do with neurosurgery, but it's an ultrasound examination checklist. So if I would do in advance my checklist, I could be pulling my checklist here, and as I'm doing the live procedure, I can fill it up. So, okay, the name of my attendee is Joe Blow, the date, then the name of the hospital. Okay, was the adjustment of gain and depth adequate? Yes. Position on the chest, it's correct. And then did he identify the structure well? Left atrium, left ventricle, right ventricle. If I want to take a snapshot of the screen, I just do so. I click on the little camera here, snapshot. And after taking the snapshot, I can put that snapshot in my checklist just like that. Okay. So now I'm building my checklist live with all my answers, my images. So again, the important name in React, as I told you before, is integration, so that you can put everything together without having to have 5 different platforms. So I think I'm going to stop there and see if John has any questions. So the idea here today was really just going to stop sharing my screen. Stop sharing. Okay. The idea was really being able to give you that feel of what Reacts can do in terms of interaction, putting live video feeds, interacting on it, either live or asynchronously, and how this can differ from existing standard video collaboration platforms. In terms of interaction, putting live video feeds. So, John, I hope the quality of the presentation and the video feeds were okay on your end from what you...
It was excellent, and I'm sure Ike loves this platform. One quick question. Would you have someone to help mentor someone, how to operate everything and stuff?
Okay on your end from what you...
It was excellent, and I'm sure Ike loves this platform. One quick question. Would you have someone to help mentor? Yeah, Ike. Everything. I'm playing my video. Do you have questions for Yannick?
Yes, Yannick. I'm hearing a lot of background voice. Ramesh is joined.
Playing my video. Do you have questions for Yannick?
Yes. But Ramesh has joined. I'm hearing a lot of background voice. Ramesh is joined.
Playing my video. You have questions for Yannick? Ramesh, please mute. Ramesh, please mute.
Ramesh has joined.
Hello?
Can you hear okay, you guys?
Yeah, John, I'm trying to fix up the camera here.
Ramesh, please mute. Ramesh, could you please mute your microphone?
Hello?
Yeah, we're getting feedback from your microphone.
Yeah, John, I'm trying to fix up the camera here.
Ramesh, please mute. Sorry about that.
I
We're all learning this tech. Yeah, we're getting feedback from your microphone.
Switch off my microphone. Okay, I will do that.
Yeah, please mute it. Mute your microphone. It's at the top of the screen.
Okay.
There's 6 icons. Click on the microphone. Mute it. There, perfect. Okay, thank you. Okay,
Yeah, Yannick. Well, Ramesh is from Charing Cross Hospital, London. Well, I just listened to your talk. You have nailed it. That's all I can say. These are the things that I have been looking for a long time. You know, Ramesh is one of the persons who is potentially can do cystoscopy. So, for example, if there is a case and I could help Ramesh or Roy or somebody or Go in China, if I have this reacts, then I'm sure I can help them without any problem because these are accomplished surgeons. And the same way, they could help me for a procedure that I am not very happy with doing myself. So, a few questions that I have for you is, we had this meeting called Virtual Reality Meets Medicine, MMVR. So, I was part of it about 10, 15 years back. At that time, we had this haptic gloves where we could, get a feedback by a magnetic field. We could get the feedback on your gloves as to what the object was made of.
Yep.
Now, another thing I wanted to, one of the reasons I'm visiting Calgary is that my very good friend Garnet Sutherland is there. If you don't know Garnet, but Garnet is a guy who did the first robotic neurosurgery in the world. So he developed this robot called NeuroArm, and it is in the second. He did the surgery with the NeuroArm 1. Now he has developed the NeuroArm 2. And so we are planning to collaborate with him, and then we are definitely interested in remote assistance of surgery. Now, we have to, I have picked up about 50% of what you said because I could not understand everything. You being a doctor, you probably might be sympathetic to people who are not very bright on, these kind of things. But I could understand 50%. I understand what is the potential for this. It's huge. It's really massive. So we need to sit down with John and probably have at least 4 or 5 sessions, and probably I can give you a few inputs as to what I would want in a program like this. Maybe you already have it, and it's just that I'm not understanding that you have it. Next thing is that you can tell me how. The sessions, these libraries, and the features that you have is just amazing. It's really amazing. So, do you think it's possible for you to probably give a talk to the Asian CNS? We have a meeting in Dubai. It's going to be one of the largest meetings in the world. We have 49 member countries, and the guy who's doing this meeting is Imad Kanan. So I would tell him, if you can come personally, fantastic. We'll invite you as faculty, or you can do that on a hangout. We will hang out. So Ramesh,
fact, what we would do wouldn't be Google Hangout, but we would do a direct React session, so that we could be doing a live demonstration of all of that, where I could be connected, with monitors, and we interact together. So it's very, very easy to do. So we'll talk offline about that, but we could easily set up for a live. I did that in during multiple conferences where I'm in Montreal, and you're there, and we can do a live interactive sessions with live feeds and everything.
Oh, that'll be great. So Ramesh, are you there, Ramesh?
Yeah, he's scheduled next. You guys definitely got to get together and further this relationship. I'm sure you guys are going to go places together.
You should watch these videos for Yannick, and it's amazing. I was just thinking of telling Imad when he's holding his conference. I think it's more than a lot of boring neurosurgical lectures. This is amazing. This is, I was wishing to, when John told about Yannick, I was really planning to hear about it. And this is one tool I can really use to get cystonostomy also going, because I can ask him how is that. He can literally interact on the video, which means I put up a microsurgery, from the microscope, if I put a feed, I can literally put a scalpel on that place, or I can put a drill on that place and show this is where to drill. It's amazing.
Yeah, I mean, I watched the last bit of it, and I was just awestruck. I missed the first part, so I felt that it's just out of the world kind of thing, technology, and it'd be great to have Yannick with us.
Yeah, amazing. So I'm right now in the WFNS, that Hakuna Matata group. Imad is there, so I will WhatsApp him about what's happening with this thing, and then I think we should call him to Dubai in 2018 when this meeting, our ACNS next meeting is on. I think we should call Yannick, and probably he should give one of the keynote addresses he should give on this. Probably we'll have a React session, and people should realize what's the potential of this program. I hope by that time he would have gone far way ahead too. Yeah. And I'm going to have some sessions with him and John, and then we will talk about how it works. Now I have only a very a vague idea of how it works, and I'm not very sure of how it works, but I see the potential.
Yeah, I agree. I think it's the world is getting smaller with all this technology, and you don't have to go or travel around to or to go to other operating rooms to teach. You can just do it online.
Well, you know, when I heard about what I was doing with cysternostomy, and I knew about Yannick's program, I thought, man, these guys got to meet. These guys got to meet.
Yeah, good idea.
Yeah. So, okay, we're going to start our next session. Yannick, thank you very much.
Thank you very much, and we'll be in touch, Hype and John. So just let me know whenever it's good for us to talk.
And congratulations on your funding too.
Okay, thanks everybody. Have a good day.
Okay, see you.